I talk about this one all the time. It's about how where the pain is isn't always where the problem is. And I want to talk about just a few of those symptoms that are actually related to the health of your neck that you would never think is actually connected with this part of your body. Hello everyone out there, this is Dr. Jeffrey Hanna at Clear Chiropractic, where we talk about how to take care of your neck. And what I've got here for you today is pretty much a brand new research article that's talking about a condition known as degenerative cervical myelopathy. In other words, mechanical damage through the neck, where maybe there weren't any broken bones or bleeding or even bruising, but damage that still happened on the inside, affecting the joints, the bones, the disc spaces, and also the curve of your neck. And what this can do is this can accumulate like rust over a long period of time, causing stiffness, aches, pains, and damage to the muscles, the ligaments, but most importantly, the nerves, the spinal cord. We oftentimes don't think about it unless we're in a state of crisis. Our neck is the literal lifeline between our brain and the entire rest of the body. It is the communication pathway where all the messages are going up and down. Not just about what's happening in our neck and our shoulders and our head, but of our entire body, our hands, our legs, everything. And if there's a problem in your neck, that can start screwing around with the communication for any and all of those kinds of areas. And as a result, you can get symptoms in parts of your body that you never think are actually related to your neck. So let's jump into this, have a little look and see what we got. All right, here we are. The frequency of symptoms in patients with a diagnosis of degenerative cervical myelopathy. What these researchers did is they went through the literature that was available on the topic, again, progressive wear and tear down and through the neck, and they wanted to see, well, what were the most common symptoms that people reported when they were experiencing this particular kind of condition. And I think that the results are going to really, really surprise you here, because they're not talking about the usual things that we talk about when we think of a neck condition. Things like neck pain, headaches, dizziness, vertigo, tingling in the hands. We'll talk on that one a little bit here, but have a look at the symptoms that these researchers found are actually related to the neck. Okay, most frequent and sensitive symptoms in degenerative cervical myelopathy include unspecified paresthesias, 86%. What this means is weird tingling or abnormal sensations in any part of the body. And here's the thing, it doesn't necessarily make sense. So what do I mean by that? If I was going to talk about, for example, carpal tunnel syndrome, something that people are, pretty familiar with, tingling and burning pain into the hands, that follows a very, very specific distribution just like this. Person says, yeah, it's on the palm side right here. It's my thumb, my index, and my middle finger. All right, we're thinking something along the lines of carpal tunnel because that is a very clear-cut nerve pathway. However, when we're dealing with conditions involving the spinal cord itself, it doesn't necessarily follow clear-cut defined boundaries. So it could be the tips of your fingers only, but then it can be the palm on the other side, or it can be a little bit of spot in your leg, and it's not following a clear-cut nerve pathway. And this can drive a person absolutely insane because they're having nerve conduction velocity tests done. They're having all different kinds of different diagnoses to try to figure out, well, what is the exact peripheral nerve pathway that's producing these weird symptoms? And they're not thinking that it's possibly the spinal cord in their neck itself that is creating a bunch of mishmash, crisscross, weird kind of findings. Hand numbness. We kind of already alluded to this one, and this is a super duper common one when we're dealing with degenerative problems in the neck here. That is where you're going to start to have tingling, numbness, burning. Again, it's not always carpal tunnel syndrome. Carpal tunnel syndrome will happen when you've got compression at the wrist right here, which is decreasing nerve flow, possibly even blood flow into the hand here. However, this is a downstream effect. If you've got a problem going all the way up through here, this is an upstream effect that can be affecting what we perceive going down in the periphery. And oftentimes, with this phenomenon, I've talked about this before, called double crush, that this may only be responsible for about 5% of all the symptoms that are going on. There could be another 15% going on here, but the vast majority can be coming from somewhere up in the neck, and it actually doesn't have anything to do with the hand at all. What else do we got? Hand paresthesias, numbness, tingling, 79%. Neck and or shoulder pain was present in 51% of patients. Interesting that that's only about half. I would think normally it's going to be a lot higher, but this goes to one of our other points we oftentimes talk about on this channel, and that is just because you don't have pain doesn't mean that there's a problem. There are 3 kinds of sensory nerve receptors in your neck. You've got pain receptors, but then you also have proprioceptors. They are responsible for muscle tone, muscle tension. And then you also have what are known as pressure receptors that go to the parts of your brain that are responsible for balance, equilibrium, and eye movements. Our point being, only one of those 3 kinds of nerve pathways actually produces pain. So a person can have postural distortions, tight muscles, they can be feeling dizzy, they can be feeling all kinds of different things, and they don't think that it's associated with the neck. Why? Because they're not experiencing pain necessarily there, but that is the whole point. Just because there isn't pain doesn't mean that everything is necessarily okay. Now, many others, so this is going to be few less, but so now we're talking about less frequent symptoms, but again, symptoms related to the neck, not to anything else. Back pain, lower extremity pain, also bladder dysfunction. Now they say uncommon, but 38%. 38% is not exactly a small number right there. Now, a person might be wondering, okay, well, how is it that that is even possible? How is the connection in the neck going to be related to bladder function? Well, in brief, the smooth muscles that normally control bowel and also bladder control, those nerves have to travel from your brain through your cervical spinal cord. And if there is a disruption as it's going from here en route down to the bladder, then you can essentially have a transmission error. In the same kind of way that we're talking about, I feel lower back pain, or I feel tingling in my feet, or something like that. That information has to travel through your neck up to your brain. If there's a transmission error, you could be experiencing some weird symptoms in that part of your body, but that's not actually where it's coming from. The problem is actually right here. Now, the flip of that is it goes the other way as well. If you've got motor signals that are supposed to be going down, but they're not getting through the choke point, whatever's going on in your neck, what that means is it means that you could be having motor functions, motor dysfunctions, including bowel, bladder, that actually doesn't have anything to do with the area that's involved. You may mean you need to look higher. Now, also having, relatively high, 23% bowel dysfunction, also sexual impairment. Now, here's also the big one. This is the last one that these guys talk about. Gait impairment is also commonly seen in patients with degenerative cervical myelopathy. 72%. We oftentimes think if we're seeing the person's not moving their legs properly, they've got a shuffling gait, they are leaning toward one side, they've got foot weakness, they've got glute weakness, we're thinking, okay, we need to look at the lower lumbosacral nerve roots. Why? Because these are the electrical wires that normally go to and control all the different movements in your lower legs. But if there's a problem going on here, exact same. This is a downstream effect. And where the symptoms are, the evidence of the gait problem may not be where it's coming from. And our point being here is if a person's got a gait abnormality, they are not walking smoothly. They're starting to hunch over, lean forward. We see this one all the time. A person's head leans all the way over like this, and they're walking relatively abnormal. Do not ever forget to have a look at the health of the neck, because that could be having a major role in what's going on here. So what's the takeaway message here? Where the pain is isn't always where the problem is. And no matter what kind of symptom you might be experiencing in your body, yes, explore it. But if you're doing all of the normal treatment to affect that end area, but it's not quite working, do not forget to have a look at the health of your neck. And what do you do about that? That's where a Blair upper cervical chiropractor is able to help. What we do is we focus specifically on the health, structure, mobility, but also stability of the joints in your neck. Not just for the sake of the muscles, the bones, the joints, but most importantly because of the nerve flow that's going on in this area. And if you've got even that tiny little vertebra that's locked into the wrong position and disrupting the normal transmission of those messages between your brain and between your body, that can affect your health, your well-being, your life in ways, again, that you never think are associated with the neck. So what do we do in the Blair technique? What we do first are a series of diagnostic tests to find out, well, what do you actually need? And because then any treatment that we do is going to be tailored for you, there is no bending, there is no twisting, there is no cracking. This is not general manipulation. This is a precise corrections that's designed just for you to help you accomplish the greatest possible life-healing opportunity that your body is able to do. So where do you find more information about this? Well, you can go to blairchiropractic.com, find an upper cervical chiropractor near you. What you can also do is check out my personal website, which is drjeffreyhanna.com, where we've got all kinds of different blog articles, videos just like this one. It gives you a lot more information about how it is that your neck can affect all kinds of different areas of your body. Last but certainly not least, if you are in the Western Idaho, Eastern Washington area, we're part of the team here at Clear Chiropractic Spokane. You can go to clearchirospokane.com. Reach out to us. Say that you saw this video here. We would be happy to help you out in any way that we possibly can. Thanks for watching this video. I hope you've enjoyed it, found it valuable, informative. Please do share this one with friends, family who you think need it. This is Dr. Jeffrey Hanna at Clear Chiropractic Spokane. Get well, live well, stay well. Till next time, take care. Bye-bye.